Well, the latest CDC data shows 57 cases of measles in just 1 week. That's the highest weekly tally reported since the record outbreak in 2019. Now, most cases this year have been in the state of Texas. Here in Colorado, cases do remain low, but it doesn't mean we're in the clear. So joining us right now is MSU Denver Assistant Professor of Biology, Dr. David Merriam. Thank you so much for joining us.
Glad to be here.
Big topic we're talking about here. So if measles vaccination rates do remain lower than years before, and cases continue to pop up, do you believe this could possibly be the next pandemic?
I don't think that we're looking into a pandemic here.
Okay.
And that's primarily because when you see these cases pop up, it's always in regions of very, very low vaccination rates.
Okay.
And what tends to happen in general is when a disease starts to rise, even people who might be vaccine hesitant start to think, maybe I'm going to play the risks and actually get the vaccine at that point.
Well, let's talk about that vaccine hesitancy, because it feels like it's happening more and more as the years go on. Why do you believe communities are turning away from the measles vaccine in particular?
I think that, well, first of all, the measles vaccine or vaccine hesitancy has been with us since the very first vaccine that ever came out. Mm-hmm. You can see political ads from the 1800s of people saying vaccines are bad for you and they're going to turn you into a cow, of all things. And so I think that what we're seeing is as government distrust rises, you're going to see likewise anything the government is supplying gets distrusted. And there becomes a lot of fear that surrounds that. And then you have certain popular figures also out there in the media sharing, oh, you know, this is causing any number of other diseases just by getting the vaccine. And that's going to raise, I think, understandable fear in people.
Yeah. Well, at the very least, it raises questions for a lot of people who are vaccine hesitant. So we have the vaccines now, though, but just who's most at risk for getting the measles?
Most at risk, you're going to see especially children under a year of age, because those are children who haven't gotten the first dose yet. You can't get the dose until after your first birthday. So those children are going to be high at risk. Likewise, anyone who is particularly immunocompromised, because if your immune system is weakened, then you're not going to be able to really fight off the vaccine. The vaccine's not going to do much for you at that point.
Right.
And then last, of course, the elderly, because as you get older, by the nature of being older, your immune system kind of starts to weaken.
Right. We only have about 30 seconds left, but to be clear, cases are still very low. But for people who may be worried, what are some advice for those?
I would say, first of all, don't panic. Again, as long as you are vaccinated and those you care about are vaccinated, you should be okay.
Yeah. All right. Dr. David Merriam, thank you so much for joining us. Such a very important, very hot topic right now, for sure. We appreciate it. You can watch all of our interviews on our website right now at cbscolorado.com.